Welcome to all of you. My name is Peter Krustrup. Today I would like to tell you about the concept of football fitness and how this type of training actually contributes to the prevention and treatment of lifestyle diseases. It is now clear from the literature that physical activity is very effective in the prevention and treatment of lifestyle diseases, and that sport participation contributes a lot to the intense training for the population and also to the health of nations. And in a very recent meta-analysis that came out just 3 months ago, it was found that the very best evidence for the fitness and health effects of sports relates to football and running. In this model, you can see all the main areas of fitness: metabolic fitness, cardiovascular fitness, and musculoskeletal fitness, and how these types of fitness relates to the risk of cardiovascular disease, including type 2 diabetes, cardiovascular disease, and osteoporosis. Over the last 12 years, our research team at the University of Copenhagen Faculty of Science has investigated the fitness and health effects of football and other team sports. And we've looked into participant groups across the lifespan and also patient groups. We have used a number of methodologies focusing specifically on the various types of physical activity and also the effects on the various types and areas of fitness. And this includes investigations in football, team handball, basketball, and floorball, but also running, swimming, dancing, and various types of fitness center training. Several years ago, we conducted a randomized control trial comparing 4 very popular types of physical activity, which was jogging, interval running, football, and strength training. And we found very positive effects of all the 4 different types of activity. However, only football had positive effects in relation to maximal oxygen uptake, fat percentage, muscle mass, as well as bone mass. And this led us to investigate whether football training is actually a combination of endurance training, cardio, HIIT training, and strength training. And indeed, we know now that football has very huge effects in terms of aerobic fitness, which is defined as a maximal oxygen uptake divided by the body weight. And as you can see here, there are large and systematic effects when we compare the effects of football fitness and an inactive control for women, and also very large effects for men, comparing the effects of football fitness with inactive controls, but also other types of training. And actually, these large effects on maximal oxygen uptake corresponds to a decrease in the risk of cardiovascular disease of as much as 50%. And there are many other positive effects on the cardiovascular risk related to football fitness. And one is the effect on blood pressure. And in these studies, we have shown very large declines in blood pressure for hypertensive women, 12/6, but also hypertensive men, 13/8 millimeters of mercury, after only 15 weeks of football training, 2 or 3 times 1 hour per week. And actually, these effects correspond to a successful medication of these hypertensive patients. In relation to type 2 diabetics, we've investigated the effects on body composition. We've seen very large declines in fat mass, but no changes in muscle mass. And we've also seen very large effects on the blood lipids, including triglycerides and cholesterol. And surprisingly, we have seen that football fitness training can actually increase the bone mineralization of adult women. Here are the results from a study, 2 times 1 hour per week for 14 weeks, showing an increase in the bone mineral density of the left and right tibia of 2.5%, which actually corresponds to a decrease in the bone age for these women of 2.5 to 5 years. That's a good investment. Only 14 weeks of training. And last but not least, we have investigated the effects of football fitness for elderly. In one cross-sectional study, we compared 70-year-old footballers that had played football their whole life with 30-year-old untrained men. And we actually saw that the postural balance was similar between these groups, and also that the 70-year-old football players had a similar rapid muscle force compared to the untrained 30-year-olds. And this is very important in relation to the risk of falls and fractures. And it's also a wake-up call for 30-year-old untrained men and women. It's certainly also so that you don't have to be good at football. You don't have to have a lifelong career to have positive effects of football fitness. In this study, we recruited 60 and 70-year-old men with prostate cancer in anti-hormone treatment. Many of them, most of them actually, had never played football before. But we observed that the side effects were minimized with football fitness. In this case, only 12 weeks of training, 2 times 1 hour per week. We saw a marked increase in muscle strength and also muscle mass, despite the fact that they had no testosterone. And after 32 weeks of training, we saw marked positive effects on bone mineral density compared to large decreases for the control group due to the medication. And this related both to the femur, to the hip, and also the spine. So very positive effects. Football can be used as rehabilitation of cancer patients. So now, a very important question. Why? Why is football such an effective combination of training? Why is it an effective all-in-one type of training? With regards to the cardiovascular fitness, it's definitely related to the very high heart rates during the training. This is the case for children, for adults, and for elderly. As you can see here, there's a large fraction of the total time in the very highest aerobic intensity zone with heart rates above 90% of individual maximal heart rate. And this relates to 65 to 75-year-old players and also patient groups like type 2 diabetics and prostate cancer patients. In addition to that, we got a very good stimuli to the muscles and the bones because of many intense actions, backwards runs and forwards high-intensity runs. And in addition to that, more than 200 specific intense actions with a high stimuli to the muscles and the bones per hour of football fitness training. That includes decelerations, turns, dribbles, tackles, jumps, and stops. And last but not least, we got a very positive metabolic training. A man like me will actually have an energy consumption of 750 kilocalories per hour of training. And I'll use all the energy systems, including fat oxidation, but also anaerobic exercise with a high muscle lactate production. And at the same time, our investigations show that there's a huge glycogen depletion in all the different fiber types, telling us that all the fibers are active during football fitness training. And here's some nice video footage of untrained women playing football like they do on the Faroe Islands and in Denmark, with a lot of stops, a lot of sprints, a lot of turns, a lot of dribbles and shots, and also good fun because it can be social and fun to train hard. And many of these women had actually never played football before they started their football fitness career. So now we are ready to describe how the different components of football fitness actually contributes to the 3 main areas of fitness. because of the high heart rates, because of the high energy production, because of the speed and strength elements, and because of the bone impact. And as you can see here, the arrows tells us that there are optimal effects, providing a positive stimuli to all the three main areas of fitness, and thereby to the risk of lifestyle diseases, including type 2 diabetes, cardiovascular disease, and the risk of falls and fractures. So the overall conclusion is that football fitness is intense and versatile, and that it combines cardio training, endurance training, and strength training. It improves all the main areas of fitness. And football fitness is nothing like 11v11 on the television screen. It's few players, small pitches, it's high intensity, involvement, and a high success rate, even though you have little experience before you start. And there's a lower injury risk, which is very important when we're talking about changing health of an untrained population. And yes, it does indeed have a large impact on the risk of cardiovascular disease, metabolic disease, but also osteoporosis. And it has a great potential in the prevention and treatment of lifestyle diseases, along with the possibility of using football fitness as rehabilitation for prostate cancer patients. And yes, it is indeed for participants across the lifespan, and the skill level is actually not important. Everybody will benefit from this participation. All these investigations have contributed to the design and implementation of various sport for all concepts for untrained women, for children, for homeless men and women playing street football, but also for various patient groups. And our studies also relates to other team sports like handball, like basketball and floorball. And if you want to read more about this research, we have a lot of scientific articles on our homepage at the Copenhagen Center for Team Sport and Health homepage. And there you can also see that these results have been disseminated to more than 100 countries and have been broadcasted on more than 50 British and American television companies, including BBC, CBS, and CNN. Thank you very much.